Welcome to the deep dive. Today, we're tackling something of a paradox, actually. The very places dedicated to our health hospitals, healthcare systems, they have a pretty significant environmental footprint. Not exactly the first thing that springs to mind when you think about healing, is it?
No, it's absolutely an unexpected truth, and it's quite profound when you dig into it. So this deep dive, we're really pulling back the curtain on, how the health sector impacts the planet. We'll look at what green hospital actually means, and some really innovative ways institutions are, well, leading the charge. Our mission really is to see how quality care and environmental responsibility can actually work together.
Right. Because you think pollution, you think factories, maybe power plants, not hospitals. But the data tells a different story. How big are we talking here?
Oh, they're incredibly resource intensive. It often just flies under the radar. Take the UK's National Health Service, the NHS, huge system. It's responsible for nearly a quarter of all public sector emissions there. That's about, 18 million tons of CO2 every year?
Wow, 18 million tons just
Yeah.
from the NHS.
Yeah. To give you a sense, that's roughly the annual emissions of a whole country, like, say, Latvia. And over in the US, the health sector is actually the biggest consumer of carcinogenic chemicals. So there's this hidden environmental cost to healing.
Okay, those numbers are genuinely startling,
Right.
especially, like you said, from a sector meant to keep us healthy. So that's the challenge. What about the opportunity side? What does green or sustainable even look like for a hospital?
That's the key question, really. Definitions can differ a bit, but the core idea, the US EPA puts it nicely. It's about creating structures and using processes that are environmentally responsible and resource efficient through the building's entire life. So think design, construction, operation, maintenance, all of it. Healthier for people, healthier for the planet.
Okay, designing for the planet and people. Is this a totally new idea, or does it have deeper roots?
Yeah. Oh, it definitely builds on decades of thinking. I mean, sustainability itself goes back to the 70s, those early environmental movements. Then you had things like the triple bottom line concept in the 90s gaining steam. This idea that success isn't just profit, it's also social equity, environmental impact. That kind of thinking paved the way for green hospitals as a practical application in, well, a really critical sector.
That makes sense. It connects the dots. But it sounds incredibly complex for a hospital setting. Are places actually doing this well, or is it mostly theory?
No, it's absolutely happening. And we can measure it. Systems like LEDB, that's leadership in energy and environmental design, they rate buildings on things like water saving, energy use. You get different levels right up to platinum. And some hospitals are really nailing it. Kohinoor Hospital in Mumbai, for instance,
Yep.
they hit LED platinum, highest rating, first in Asia, only the second hospital globally at the time. That's huge.
Platinum, wow. That's impressive. But you mentioned complexity. What are the big hurdles? It can't just be easy, right? Just flip a switch.
Definitely not. Hospitals are unique beasts. They run 247. That means constant system redundancy, massive energy needs, like 2.1 times more energy per square foot than your typical office building. And water. We're talking 80 to 150 gallons per bed per day.
Per bed, per day.
Yeah. Then add infection control. That requires specific waste handling, lots of hazardous waste, maybe half a kilo per bed per day. Scale that up globally. It's staggering. Plus, you've got competing budget priorities, the perception sometimes that green costs more up front. It's a tough sell sometimes.
It really does sound like a mountain to climb. But despite all that, you said innovation is happening. What are some cool solutions you're seeing?
The potential is genuinely massive. We think hospitals could save 20–30% on energy, maybe more. Look at Sir JJ Hospital, also in Mumbai. They saved 812,000 kilowatt hours and about 90,000 US. How? Simple stuff mostly. Awareness campaigns, using natural light better, sealing AC leaks.
So practical steps can make a real difference.
Exactly. And it's not just energy. Bhopal's Sambhavna Trust Clinic, they use rainwater harvesting for the dry season. Or get this, the Embassy Medical Center in Colombo actually converts hospital sewage into biomethane and uses that gas to help power the facility.
Wow, waste into energy right on site. That's pretty amazing. Any other areas?
Oh, yeah. It goes wider. Think supply chains, promoting local, healthy food sourcing. That cuts transport emissions, helps the local economy. Optimizing transport for staff and patients, too. Encouraging public transit, maybe more telehealth to cut down patient journeys. It shows being green isn't just the building itself, it's the whole ecosystem of care.
So, okay, wrapping this up then.
Right.
What does this all mean for you listening right now? It seems pretty clear that top-notch patient care and being environmentally sustainable, they aren't opposite goals. They actually seem to be getting closer together.
Yeah, what's really fascinating is that Green Hospital isn't just some nice idea anymore. It's not niche. It's a real thing. It's happening. It's being copied and adapted all over the world. And it kind of proves that a healthier planet really does support healthier people.
Which leaves you with a question to think about. As this whole movement grows, how might these greener ways of doing healthcare influence your choices?
Yeah.
As a patient, someone in the community,
Hmm.
maybe even if you work in healthcare yourself, something to mull over.